pregnant mothers lose their young ones as the government makes strict COVID-19 guidelines on transport and movements in Uganda. Halima Mubiru, 35 years, a mother of 5 children from Nyakakoni, Isinjo district, escaped death narrowly coronavirus disease of 2019. COVID-19 found her pregnant, and when she went into labor, she had to trek to a nearby sub-county health center 2, which is about 5 kilometers from her home due to lack of transport. The government banned all private means of transport in Uganda as one of the guidelines to prevent COVID-19 from spreading. She made it at Chikokwa Health Center 2 in Kaberevere by 9 a.m., though nurses were reluctant, and later at 4 p.m. transferred her to Mbarara Regional Referral Hospital, which is 42 kilometers away from the health center, and in the process lost the baby.
My relatives broke the rules and forcefully drove me to Mbarara Regional Referral, but the process was too long. I lost consciousness. Only to wake up, I was on life support on a hospital bed. I lost my baby. I survived. I would have died too.
Halima Mubiru is not the only woman who regrets COVID-19. Sharon Mubiru, 24 years, a mother of 2, lost her unborn baby after failing to access a health center 2. Her case is that she developed a labor in early morning hours before the official time that the government allowed people to move from their homes. The husband not around at the time, she was left with no option but to deliver herself and ended up losing her baby.
When COVID-19 came, the village leaders came registering pregnant mothers, promised to keep on checking on us, but they did not come back thereafter. When labor came, I did not know what to do next. No vehicle, no nearby hospital.
This comes at a time when sub-county health centers are less functional, as majority of the health workers at these health facilities could not accept to be frontliners during COVID-19, citing lack of protective gear, hence fearing for their lives. Dora Nisima is an expectant mother that we found at Ihunga Health Center 2 in Mwizi Sub-County, Mbarara District. She is among the expectant mothers who are feeling the pinch of health workers who are not willing to work due to lack of protective gear.
I came here in the morning. The doctor checked on me, though he did not show me the bed to lay on. He told me to walk around. It is evening, but they have not checked on me again.
The government is not giving us protective gears. They give us disposable masks and want us to reuse them.
It is really sad that money can come and we are not considered. It is sad that kawunga and the milk they've been serving can come and for us we are not considered. So I am just echoing my voice. I'm just a common worker. There's no way how you will tell a mother who is laboring to leave the mask on. The contraction is there, she's pulling everything there and there. You're with her, you have to save the baby, you have to save the life of the mother. There is no way how you will say corona, no, you have to save the life of the mother, you have to save the life of the baby. I'm just saying if we can be motivated.
In Chisora district, some health centers closed a long time ago, and it is this reporter that tipped off the district health officer about it. We found Chisora Town Council Health Center 2 closed, and Nyabuhuniko Health Center 3 tried to reach one of the in-charges of these health centers on phone, Justin Nyirashabina, who informed us she had gone for lunch but later came and opened. The neighbors to these health centers had mixed reactions.
Center 3 has only 2 nurses. They work when they want. The center can even spend a month closed. We reported, but the district official...
The health workers need to sleep around the center. Either they don't have medicine, or health workers are not there.
Efforts to reach Dr. Nick Muneza, the assistant Chisora district health officer, were in vain as he kept on dodging us for 2 days. Apart from some health centers being inactive, some mothers believe that some workers at these health center 2s and 3s are not skilled enough, something that district health officers deny and put the problem on poor infrastructure.
COVID-19, when it struck not by surprise, but the wave was so fast that it took most of the governments a little bit unaware, unprepared, when most budgets had been passed. And for that matter, as health facilities, we were affected in a number of ways. Now, the only gap that is in between that maybe is an experience to learn from is the preparedness in terms of resource allocation. In terms of resource allocation. In terms of foresightedness, particularly for such things, the outbreaks that come on board. Maybe point number 2 is to in terms of infrastructure-wise, we need to check into our infrastructure setting, particularly not only for the pandemic, but even for other key priority events that might need isolation, special care, and attention, infrastructure-wise. Because you see, we're looking for places where to put suspects, for instance, and you either close a school or you try to improvise with another structure way, which would have been maybe within the setting and is well organized. That's also a gap that we notice.
In Mbarara district, unlike other hospitals that experienced deductions of incoming patients during COVID-19 lockdown, the Mbarara Municipal Council Health Center 4 instead experienced overwhelming number of patients as it turned into a collection center of different patients seeking for medication after failing to access it at sub-county health centers.
Numbers never changed, instead numbers increased. Whenever a mother could come and we ask, Madam, you're from Katete, you're from Chizungu, you're from Kakoba or Kamkuzi, there are health centers there, why don't you go there? They could say, please, for us we want to come here. Health centers are open, but when we try to ask for a service, they tell us, for them they have no protective gears. We go to Castle has everything. And in actual sense, by then, we too didn't have the protective gears in any way. So for them, they used it as an excuse to relax on duty, dodging kind of. I'm not accusing them, but I'm telling you, everyone got scared of the disease, so they could try to dodge away the women. So numbers became many. April, they reduced because we got like 750 around there. In May, we got like 800. June, then it shot. We got 1,020 something numbers. Now currently, last month, July, like here I can see we got 1,023 mothers.
Dr. Alfred Mugara, the in-charge Mbarara Municipal Council Health Center 4 and a member of Mbarara District Health Board, raised solutions to some of the health concerns.
Look at the preparedness of the system to transport its health workers, to take care of the health workers. You see, it's a gap. I know for bigger facilities it might have been easier for them, but for the lower facilities, especially those who are frontliners, because remember the health workers continue working, but they were not resident, most of them at their facilities, and yet they are supposed to be coming for service. So moving from home amidst a lockdown is a great challenge, and I think in terms of transport, mobility, we need to re-equip and reorganize our setting. So infrastructure-wise and maybe budgeting and resource allocation for such preparedness is quite key to make things move.
Edgar Buriahika, a father of 5 children, says he has always escorted his wife during labor time and encourages men to be there for their wives all the time, especially during pregnancy.
It's unfortunate. Often men tend to shy away from escorting their wives for antenatal care and checkup. If you moved in hospitals, you realize they are always filled by women, pregnant women, either escorted by fellow women or by children. And these husbands, they would be the fathers to these children in the womb have left this burden, this challenge, the women alone, and this in some way affects the women and even affects the children in the womb. These are things that used to happen in the past. We are now in a different era. We expect everyone by this time to be knowing the responsibility. The husband to know the responsibility. You don't only stop at getting someone pregnant, but the care of the child is for the two parents, the mother and the father, from the point of inception until when the child is grown up, to take care of him or herself. It is really good, like in Uganda we've had some cases of child theft, for instance, and these are some of the causes, because if the husband was there to take a keen look of what is happening, maybe it would minimize this.
According to the research done by Health and Newborn Network in collaboration with Uganda's Ministry of Health in the month of May 2020, every day 15 women die in Uganda from pregnancy and childbirth-related causes. 94 babies are stillborn and 81 newborn babies die. Women in News, WIN, continues to explore how COVID-19 has affected different types of humanity and raising possible solutions to help reduce the number of women dying while giving birth. I'm Sarah Mubiru reporting from Uganda.